So thank you to our friends at Quest Diagnostics for being such great supporters of the business community through their association with entities like the Meadowlands Chamber and the Newark Regional Business Partnership. We have a really esteemed group of executives, women executives today that are going to talk about testings. We have Ashwini Dhamaswala, who is the Executive Director of Consumer-Initiated Testing and Sports Diagnostics. We have Wendy Mader, Chief Commercial Officer with Employer Population Health. And we have Ruth Clements, Vice President and General Manager of Infectious Disease and Immunology franchise. And so covering the depths of all of the testing. And if you didn't know that, and you probably do, Quest Diagnostics, a national and international company, has been in the forefront and has been a leader in COVID-19 and immunology testing, has worked closely with state governments and the federal government to really advance everything that's about testing. And so the discussion about how we gain control of this COVID-19 crisis, and more importantly, how we get back to work and how we restore the confidence of businesses and the consumer public to get back to business is critically important. And there's no bigger issue than the testing. And at this time, I would like to turn over for the first few slides. Alex, if you can bring the slides up, I'd like to turn this over to Ruth Clements, Vice President and General Manager, Infectious Disease and Immunology at Quest Diagnostics. And thank you so much to the three women for being a part of this content and webinar today. So thank you, Ruth.
Thank you so much for having us, and good afternoon, everyone. If you would have told me a year and a half ago when I joined Quest that I would be dealing with a pandemic working from my basement office, I would not have believed you. And it has truly taken a village to bring the multiple assays that we now have on the market. And I couldn't be more proud and thankful to all of the frontline heroes at Quest and even outside of Quest that work tirelessly and continue to work tirelessly to help the country fight the COVID-19 pandemic. Next slide, please. Before I jump into it, let me share a little bit about Quest. So for over 50 years, we have been the national leader in diagnostic testing, and with more than 2,200 patient service centers throughout the country and many labs also throughout the country, we are easily accessible to patients and providers. We serve over half of the physicians and hospitals in the US and provide diagnostic testing for approximately 30% of the American populations. And I always joke about trains, planes, and automobiles, but we do have a huge logistic operations with 25 planes, 3,750 vehicles, and 75,000 daily stops to pick up specimens. And this was just before the pandemic. But we continue to innovate. In 2018, we launched our QuestDirect to consumer platform, offering digital purchasing convenience for a wide variety of diagnostic tests. And this is headed by Ashwini Dhamaswala, who is one of our presenters here today. Next slide, please. Next slide. I think the slide is stuck.
You know what, Ruth? You're stuck on my side, so I'm not sure if it's showing. I guess you're seeing the same on your side, that it's stuck, because I'm on slide number 3 now, Quest Diagnostics key milestones.
Okay, yeah, I'm disconnected. I'm just going to continue. And,
okay, and just assume I'll do the next slide when you say it.
Yep, I'm seeing the proper slide.
Okay, great.
Let's give Ruth a second. It sounds like she may have lost her internet connection.
Yeah.
So Alex, now's when we need to figure out how to throw some music in and make like we're going to commercial.
Yeah.
Can you guys hear me?
Yeah,
Yes,
we got your back, Ruth.
Okay. Yeah, I could hear you guys the entire time. I don't know what happened there, but sorry about that.
No worries.
Yeah, let me just switch back to this view. Bear with me because it's not doing what I wanted to do. Okay, here we go. So we assembled a team early in January to start developing our own LDT, and thanks to the great work of our R&D team, we were able to launch our LDT on March 9th, followed a few weeks later by the Roche high throughput platform. And in April, we launched our first antibody test, our IgG antibody test, both through the provider channel as well as on QuestDirect. In May, we were granted an EUA, an emergency use approval for our self-collection nasal swab kit for our molecular testing, or PCR testing, which allows for more comfortable and more convenient specimen collection by the patient. And most recently, we were the first commercial lab to receive approval to perform pooling using our Quest LDT test, which allows us a higher throughput in our testing and increase our capacity. Next slide, please. So to date, we have performed more than 9 million molecular tests and close to 3 million serology tests. And as with any test, Quest always ensures that the tests that we are offering are extensively evaluated, that they're highly specific and have a validated accuracy. And to ensure that our patient safety and to limit the risk to our vulnerable customers, Quest also introduced a Peace of Mind program during this COVID-19 pandemic. And there are several key features of this program, one of which is the wait by text functionality, where you can actually wait anywhere you want. You can sit in your car and simply get a text from the patient service center when it's your time to come in and get your specimen collected. We also have special hours for those most vulnerable patients, 60 years or older, or pregnant, or those with underlying conditions at the beginning of each day. And last but not least, we have increased our sanitizing frequency, require face masks for those patients visiting our centers, but also our patient service representatives are wearing PPE and practice social distancing, and are even in some centers helping with opening the doors for patients coming in. Next slide, please. And I apologize, but it's not moving on my side. Hopefully you can still hear me. Okay, here we go. As you are considering the restart of your business, there may be much to consider before making that decision to return to work. There are various unknown factors, some of which are listed here, but first and foremost comes safety. And here's where Quest can play a role in helping you manage the risk of opening your workplace for employees and shopping environment for your customers. So before we get into our return to work service offerings, I first want to tell you a bit more about our COVID-19 testing. Next slide, please. So there are two types of COVID tests currently available: a diagnostic test, or a molecular test, that actually tests for the active virus and thus the active infection. And this specimen type that is collected for that is a nasal swab. And then there is the antibody test, which is a blood test that tests for antibodies against SARS-CoV-2, which is the virus that is causing COVID-19 disease. So the presence of antibodies indicates if someone has previously been exposed to the virus and has mounted an immune response. Next slide, please. And you can go to slide number 8. I wanted to dive a little bit deeper into the COVID-19 serology testing. And as mentioned just now, serology testing in COVID-19 measures specific antibodies of SARS-CoV-2, the virus that is causing the disease. And as you see here in this graph, early in the disease course, you see IgA and IgM. IgA is here in blue, IgM is in yellow. They are both earlier indicators of viral exposure and can take anywhere from 3 to 7 days to form after initial exposure, and they decline over time. IgG, on the other hand, is a later indicator. You see it here, magenta, and can take 7 to 14 days to form after initial exposure and stays elevated, as you see here in this graph. So what does a positive IgG result really mean? So a positive IgG result indicates that you have the antibody to SARS-CoV-2 and that you have built an immune response. So in other words, it indicates exposure to SARS-CoV-2 and may indicate a resolved infection and potentially protection against reinfection, although more research is needed to confirm the level and the duration of protection. If no antibodies are detected at all, it can suggest that the person has not been exposed, or the person could be exposed only very recently, and antibodies have not yet been produced. Next slide, please. So there was a lot of debate in the media, during this pandemic around the quality of the serology testing and what the results really mean. And there are over 170 serology testing notifications in process with the FDA. And under earlier FDA guidance, many companies were able to bring their tests to market under an EUN, an emergency use notification, which was simply, you notify the FDA that you have a test and you are allowed to start, selling that test. What we saw early on is that a lot of these tests, serology tests that were on the market, these point of care lateral flow tests, were not of good quality. So the FDA recently jumped in and required that these companies filed for an EUA, and many of them were actually taken off the market. Thus far, only 12 tests have been granted an EUA status for serology, and the 3 platforms that Quest is using for antibody testing all have been granted an EUA. So from an accuracy standpoint, it is important to stress that Quest works with reputable manufacturers that have extensive data packages supporting the accuracy of their tests. And in addition, as Quest, we also always perform our own in-house validation of the assays before we start testing in patients. Our own validation data, as well as the manufacturer's data package, has demonstrated that the accuracy of our serology testing performance are on par with other common serology antibody tests that are routinely performed at Quest, like measles or hepatitis B. Next slide, please. There's a lot of discussion on the interpretation of serology testing and its relationship to immunity. What we've seen in the past, and in viruses like measles, mumps, the immunity post-infection is lifelong. In others, like the previous human coronaviruses and influenza A and B, the immunity is short-term, up to 34 to 36 months. Where SARS-CoV-2 falls is not yet clear. We think it may fall into that same category as the previous SARS infection, but we don't know. And more studies will be needed to firmly establish what, if there is any immunity, and what the duration of that immunity is with SARS-CoV-2. Next slide, please. So as mentioned before, the platforms that we are using for IgG tests are extensively validated, both by the manufacturers as well as by our own internal R&D verification process. And all 3 platforms have received an EUA status. In this chart, we list the various performance parameters, and you see here that the assays are similar in their performance from a sensitivity and specificity perspective. All 3 tests have a specificity of 100%, meaning they are less likely to give a false positive result. Every test, as you may know, returns some false positive and false negative results, and the positive predictive value and negative predictive value help those who are interpreting these test results understand how likely it is that a person who receives a positive result from a test truly does have the antibodies to SARS-CoV-2, and how likely it is that the person who receives a negative result from a test truly does not have antibodies to SARS-CoV-2. And you see here that the 3 platforms perform very similarly. So what does the FDA say about the use of serology testing? So in their guidance to healthcare providers, they indicated that serology can help identify people who have been exposed to SARS-CoV-2, and that individuals whose blood contain IgG may be able to resume work and other daily activities in society. In addition, they also indicated that people with positive IgG may be eligible to serve as potential donors of convalescent plasma, which can help current coronavirus patients recover faster. The FDA, however, also says that serology testing should not be used as a diagnostic test. It can help identify who's been exposed and has built an immune response, which can help in, return to work testing decisions, but serology in and of itself should not be used as the sole basis to diagnose COVID-19. Next slide, please. There are many future technologies on the horizon for COVID testing, from rapid point-of-care antigen testing, which can result out in 20 minutes, to quantitative antibody testing, as well as a COVID flu panel, because we do anticipate with the flu season starting in the fall, that per the CDC guidelines, physicians will test for both flu and COVID at the same time to rule out one versus the other. So to discuss our return to work programs, I now hand it over to Wendy Mader, who will walk us through our Quest offering. Wendy?
All right, great. Thanks, Ruth. And actually, prior to this, I think as Ruth brought up, she didn't think we'd be working on this kind of thing. I didn't really know Ruth, so it's been good to get to know her through this process. And we have worked closely on many kind of testing capabilities and with the Chief Medical Officer organization to try and figure out how do we bring employers back to the workplace and what the right testing protocol is. So it's definitely been a long few months, but we've turned up some really great programs and some solutions for employers. So next slide, please. So just a little bit about the business that supports employers within Quest Diagnostics. It's known as Employer Population Health. We have about 20 years of experience partnering with thousands of employers. In my business, it's supporting 5,500 employers, primarily for core services such as biometric screenings for employers. Around March, many of our events began getting canceled with employer customers closing their doors, obviously. However, we knew that employers were going to need to figure out a way to get back into the office, or in fact, keep people in the office that need to stay in the office and are critical infrastructure workers. So at that time, our business really started to see an influx of employers saying, can you help us? Can you help us with services such as providing staffing for temp checks? When we want to get people into the office, can you help us think about how we might get them back in the office? And then if I have critical employees that maybe are building respirators, can you make sure my plants can stay open and provide testing services to those employees in those locations? So we certainly moved quickly, and we've stood up services that have supported employers from working on the vaccination to employers who are making respirators to employers who need to keep the retail locations open so we can all get our toilet paper and our food, right? So those are the kind of services that we've been working on. Obviously, it's been really interesting because if you think back in March when this all began, I would have told you we'd all be back in the workplace by June. And what we're seeing is a delay of returning to work and getting people back into the offices on a broad scale, rightfully so. So we have worked with nearly 600 employers and are working with many. I've had hundreds of phone calls myself, and from that process we've learned a lot. And I think that's really kind of framed what we're talking about relative to return to work. And the bottom here, it says 3.75 million. That was actually as of June 8th screen for the COVID-19 diagnostic test. And Ruth mentioned that we're over 9 million that we've actually tested, and that number is rapidly increasing given the amount of testing going on across the United States. Next slide, please. So when you think about return to work as an employer here, and this is actually Quest Diagnostics framework. One kind of known fact, obviously we're an employer in the New Jersey area with our headquarters there in Secaucus. One little known fact is that the employer population health business actually partners very closely with our benefits organization for our own employees. And anything we do within our own population becomes a framework for what we're doing at Quest Diagnostics for other employer companies, because we tend to be the first one to utilize the solutions that we're bringing to market. Obviously, if you look at the gold up here on the left, you know, medical protocols and testing is something that Quest Diagnostic really has a lot of expertise around and a lot of services around. So we were able to quickly put together a testing strategy for our employees, because as we all know, our laboratory employees are very busy. They have to be in the workplace, and we have to make sure we have protocols around them. And then around this, we've got employee safety and wellness. Our employee safety team has been very busy to make sure that we're essentially making social distancing happening in the workplace, yet being able to continue to run and process specimens across the country. New office standards are obviously a big thing. I think many people are thinking about, what do we do in the offices? Do we need shields? Do we need masks and those components? And then employee policies and norms. You know, one of the interesting things that, you know, comes to mind around serology testing and how employers may or may not use that, it may show us where, you know, diseases spread in the workplace, and where we might actually have situations where you have a workplace that's more convenient to possibly spreading disease, or an area within the workplace. And so I think that there's a lot going on, and we recognize for employers, this is a specifically challenging situation that goes beyond the testing, right? There are many things that have to be thought about around this. Next slide. So when you think about return to work for any organization, there's some key components, right? Having implemented for nearly 20 years employer programs, from a benefits design, from screenings to interventional type programs, the similar infrastructure is there, because you've got to make sure that your programs designed well for your employees, right? Lots of thought goes into it. You also have to make sure that the program has correct consent. This is just like you were going to go do a biometric screen, but in most cases that data doesn't get back to the employer on an individual level. Because this is an infectious disease, the consent itself is an informed consent, and it's important, because in most cases employers are going to want that data, and 99% of the employers I've talked to did want access to the data, so that in case they have a situation they need to contact trace, they want to be able to track that. From there, you know, because in most cases we really want to go after symptomatic employees, we want to make sure that those people who have been exposed or are symptomatic actually get access to testing, the employee questionnaire, the ability to symptom check them and say you have access to a test is an important component of the program. Then access itself to testing solutions. So obviously we started at 0 tests in March to 9 million tests now tested through the PCR testing, the molecular testing protocol. On-site resources are important, because there are employees, in fact, at the workplace. So can we bring convenient testing solutions to on-site programs? At Quest, one of the things we're doing is leveraging our provider network that typically does venipuncture type screenings or finger stick screenings, and they've now learned a whole new function of swabbing. Being able to swab or watch and observe collection, because we have very nice swabs that our team has gotten FDA approval on, where it makes it easier on someone to test themselves, and we can observe it, and our providers can do that. So we have a process for that. Community events are still, you know, the drive-thrus are still happening. We have recently partnered with Walmart neighborhood markets to enable employers to have their employees drive through the pharmacy window and get tested through there as part of an employer program. So it's a very nice program. We also have home-based unobserved self-collection kits, and we reserve those kits in most instances for employees who wake up in the morning perhaps not feeling well, and they don't need to go to work, well, you don't want them in the workplace, but you want them to give them access to some sort of testing protocol. PSC programs itself, Ruth talked about PSCs. We do not do the molecular test within the PSCs, but we absolutely do the serology test. And as you know, as you can imagine, you've got people in there that are dealing with diabetes and other chronic conditions that we did not want to mix in symptomatic folks into our patient service centers. But it is the access point for our serology testing. And then the other component I bring up here is medical oversight. All of these tests need to be ordered and have oversight. And so in all 50 states, we have medical oversight of the testing and automated ordering that works with that based on the symptomatic person, based on the program rules. And part of that component is the resulting itself, because as an employer, as you may have somebody who's positive, you want to make sure that you can connect them into care. And the medical oversight itself is an important component, because anybody who has a positive gets a phone call from a physician and gets connected into care from there. So that's a very important component that is required to be done in any testing solution. Fortunately, we've had a long relationship with medical oversight, and we were able to just implement this fairly quickly on behalf of employers. Next slide, please. Just a little bit, we wanted to share this checklist. I'm not going to go over in detail, but I think it's a good thing if you're kind of thinking through how might you return folks to the workplace. There's just some key things to think about, probably worth just making sure you have this. But I wanted to kind of, a couple things that I'll call out here is consent. I brought that up, the telemedicine partner. But, you know, what is your SOP in the triage protocol for negative and positives when they return to work? What are you wanting to do baseline testing to make sure that folks get into the workplace, or are you only wanting to go after a symptomatic approach and essentially just making sure that your employees have access to testing? And that's something we're hearing from a lot of employers. And later on in this slide deck, I'm going to kind of share a few examples of what we're hearing from employers and how employers are utilizing us and all of the other programs. I think one important component that you need to think about is making sure you have a mitigation response plan that includes contact tracing. Certainly important to make sure that you can get after disease transmission in the workplace and get those employees tested that may have been in a situation where they could have been compromised. Next slide, please. So what we, you know, as we rolled out return to work, I think it was back in May, one of the things we talked to many folks about was the fact that it is really customized by employer, but even within employer, different work groups are requiring different things. So from within an employer, what we have here at Quest is very interesting. Our lab workers, they're in a different situation than we are, you know, sitting at home and able to kind of self-quarantine at home. So they have a different kind of strategy on testing than we do as employees. And what we're finding is that employers themselves are looking at different approaches. So if you have a retail population within your workplace that is essentially out in public, working with the public quite a bit, what we're finding is that employers want to regularly make available testing to those employees. But their office employees, they're fine. You know, they're at home, they're quarantined, that's fine. So they're looking at different approaches within the population. And so that's a very important thing. We've had some limited CDC guidance on this. What we're finding is the CDC is giving guidance on healthcare workers. So can we take that guidance and really push that into other employers that are not healthcare workers and help that. So we're making that available. Obviously, I'd push anybody to go look at that and see what they've done for healthcare workers. Not all COVID tests are high quality. I think that, you know, Ruth talked about some of the serology tests that were originally approved. Very important. Not just get an EUA, but also, is there a physician oversight and ordering entity? Is there a clinical, is it clinical guided? Are the testing strategy and approaches reasonable? So it's very important for that to be part of the conversation as you're working with a laboratory on this stuff. And then, like I said, effective testing requires a wraparound solution. Questionnaires to keep employees checking symptoms. I think we're all going to be well versed in not going to work sick when we start coming back to the workplace. It's going to be an extremely important thing that we think about. But it is definitely a complicated kind of web to return employees back to work. But we've seen employers be successful at it, which has been good. Next slide, please. So a little bit about various different kind of return to work. If you kind of look at basic, moderate program, and then a comprehensive program, here's what we see when it comes around a lines of testing. A basic return to work program, if I kind of start from the right and go to the left, what you have is on-site temperature monitoring. And the interesting thing about temperature monitoring is that in most cases, what we're finding is that you're not finding folks with temperatures. Very few times you're finding people with temperatures. In fact, I came into my office today and I got my temperature monitoring and I got a band that told me that I'm okay today. But really what temperature monitoring does is it reminds you of the situation we're in. It's a good reminder that essentially we are really making sure we want to have a safer workplace. What we don't want temperature monitoring to do is create oh yeah, I'm good, I don't have a temperature, I don't need to mask, I don't need to follow the other rules. Unsafe, I guess a sense of security that's not really there. So it serves as a purpose. It's certainly something we're seeing across the country. There's an employee COVID application for triage into care. Again, physician oversight and ordering definitely required here. Then from here, what we see is serology testing for high-risk individuals. This has been interesting as we've had these conversations. Folks that have COPD, chronic disease, or those that have elderly folks at home, this could add some value. I think we're going to just continue to see serology testing be more valuable as this progresses and as we get more data around it. And then finally, PCR testing, the molecular testing for symptomatic and high-risk exposures. This is the most common thing that we're seeing in employers. They're really wanting to make sure that folks have access to some data or some testing process. And where this really works well is in employers who want to make sure that someone essentially may have been exposed or they're not feeling well, they have access. They have multiple access points because it can be hard actually to get a test. And so employers are kind of stepping in to try and support that model. Return to work with surveillance. The biggest addition here is contact tracing. There's a lot of apps popping out of the woodwork, literally, around contact tracing, data management around this kind of service. And there's a lot. I mean, I've probably seen demos of probably 20 different new apps with new technology companies. They are very neat. And I think they will have utility beyond the COVID times that we're in. So very interesting, very nice technology that we integrate data with, which that's the nice thing. If we can get the testing data into those contact tracing apps, we can get them into the kind of the full suite of services that folks are offering. It's going to be very helpful. What we find is in the kind of moderate program, employers are thinking about, well, before I return people back into my office, I want to kind of give an all clear. I want to do one test on folks, give them a clear, not necessarily all clear because we know the state of how this works, but then they also want to do a periodic PCR surveillance program. And from a comprehensive standpoint, what we find is that the addition of antigen testing we're going to see that pop up here, which is, I know Ruth talked about it, very interesting. Antigen testing in itself is going to be a rapid test that will allow us, in a less expensive test that will allow us to kind of get, as we would call a screener. And really, there's going to be a lot of use for this. I know Ashwini works in kind of the sports space, and there's going to be, you could think of folks going into theme parks, into sports facilities, getting this types of testing because it's a rapid test. I also see a lot of utility within the workplace for this type of stuff because it is a screener. And then what you do is if you end up with a positive on that, we give them the molecular test. So this is, you know, up and coming. It is certainly something that we've got our eye on and are looking to implement very soon. Next slide. So just a little bit, I find this is one of the most valuable things that we can offer when we're having programs like this, is to share what others are doing, right? That always seems to be the most valuable thing. Anytime I get my customers in a room together, that's some of the most meaningful conversations they're going to have. So, you know, here's a few examples that we have. We have a critical financial infrastructure employer actually out in the New Jersey area that we're working with, but they have offices all across the country as well. And they're required to work from the office because they are trading and they need to be in that office. And so they are having biweekly events in main locations to make sure the locations stay clear, because if their employees went down in an outbreak, it'd be a situation. They're also doing unobserved home kits. Those are our kind of self-collection kits for the smaller locations where they don't have a big population, but they need to keep them open as well. Then we've got the retailer. They're holding regular monthly testing events in hotspot locations. So this is a pretty large retailer, but they're focusing on hotspot locations, and they're actually using their pharmacists. The pharmacists can observe these collections, and so they are using their pharmacists to observe the collections. They're also using unobserved self-collection kits as well on a limited basis in stores that don't have pharmacies. California is an example of an area in which they can't put pharmacies in. And then finally, a really interesting situation kind of came up in this whole time, is that, you know, your biomedical and manufacturing folks that are selling into hospitals. We have reps in Quest that are working in hospitals, going to physicians' offices. The health systems are saying, we need you to be clean. We need, you know, the sales reps coming into those hospitals to be clean. And so we need to make sure that they have access to testing, or they've had a test in the last 14 days. And so what we are doing is we are working with them to open up the unobserved collection kits to their houses so they can get that done, or access to our Walmart neighborhood market locations so they can go get tested, and they can kind of get that all clear so they can get in and help in those surgery theaters as people return to care, and also work with the physicians that they need to work with on the services that they're offering. So all very different situations, but different flavors. Different employers need different things. So I appreciate the time. I'm actually gonna, I think on the next slide, hand it over to Ashwini.
Thanks, Wendy. So as Ruth mentioned, we launched QuestDirect at the end of 2018, and QuestDirect is our consumer-initiated testing site where consumers can purchase testing for themselves with the support of a third-party organization that provides medical oversight. We really wanted to offer something to consumers in a medically responsible way, and through conversations with Wendy, Ruth, and others within Quest, we realized that QuestDirect has a role to play beyond providing a solution for consumers who are searching for testing online. Our small and mid-size employer solution is a simple approach that leverages QuestDirect. It's an approach where there's a standard agreement for the employer to sign. We can provide the employer, we can provide you a batch of unique single-use promotional codes that you can assign to each one of your employees, and they can utilize at checkout. And then the employee would visit a patient service center, and their results are available in 2 to 3 days. Next slide. The QuestDirect experience as part of a solution for small and mid-size employers, it's really been designed with the employer and the employee in mind. It's a full end-to-end digital experience with the exception of the patient service center visit. And at the end of the experience, if an employee has questions regarding their results, they have the ability to connect with a third-party provider, a third-party physician network that's providing the prescriptive authority and medical oversight for every QuestDirect order. And that third-party physician network is available for any questions that the employee may have about their results. And as part of the process, the employee would register for a MyQuest account. So results would be made available to the employee through this account. And again, it's completely digital. And the results are easily emailable and shareable, so an employee they're in control of their results, and they could share the results with the employer. And that way, does your employee have an immune response to COVID-19? Next slide. And as we think about QuestDirect, some of the solutions that Wendy and Ruth referenced, we'll be evaluating them for QuestDirect as well. And so our programs are really designed to help you and your employees. And from the employer side, our programs can help you manage the risk of opening your business if it's closed or workplace while retaining your employees. It demonstrates your commitment to your employees, and it can increase your commitment can also increase employee participation in testing programs. And it displays collaboration with a trusted brand in testing. So the testing that's offered through any of our programs, including QuestDirect, is the same testing that a physician would order. And then from the employee side, they receive the benefit of knowing that they're supported by their employer through the pandemic, which can help motivate them to complete their testing. And it assists with peace of mind to return to work and also care for their loved ones. And then results are delivered securely within a few days usually. So with that, we'll open it up for any questions.
Thank you, Ashwini. What I'd like to do is, Alex, if you could please unmute everyone, and I would ask that you please voluntarily keep your mic muted unless you want to ask a question, but feel free to ask a question. While you're doing that, I'm going to get the ball started if I can, and just Ashwini, maybe you can talk a little bit about some of the locations, maybe in the immediate region where QuestDirect has testing centers, to just to give the audience an idea as to where they might be. And I have a bunch of questions in case others don't ask, but let's get started there.
Yeah, so we have over 2,200 patient service centers across the country, and we have several in the New York, New Jersey area, in the tri-state area. So if someone were to purchase testing or order testing through QuestDirect, they could walk into any one of our patient service centers to have their serology testing completed. And with QuestDirect, through the QuestDirect experience, as I mentioned, it's a completely online digital experience. So as the employee goes through the workflow, they will be provided the opportunity to schedule an appointment at a patient service center that's closest to them. So it minimizes their time also in that patient service center. They're usually in very quickly and out very quickly. Based upon their appointment time.
I think that most places are closing.
Terrific. Somebody's got their background noise. If you could please mute your mic.
I'll try and find it, Jim.
But still, I want to ask if they even shift. I'm sure they did something, but like.
I got it.
Okay, thank you.
Okay, so who on the line has got a question? Chip?
This is Edie. I have a question. Hi, it was a very interesting presentation. Thank you. I own a franchise. It's called Comfort Keepers, and we do in-home care. We are not Medicare. We are not Medicaid. We are private pay. And there are Comfort Keeper owners like me throughout the state. We probably employ, I don't even know how many thousands of aides, but I'm also on a board of a big association with other similar owners like myself. And so one of the challenges that many people are having is if all of a sudden they have aides in facilities, they have to do testing every 2 weeks. Aides don't necessarily have the insurance. A lot of the home health agencies are smaller, so their people don't take insurance because they end up getting New Jersey Health or whatever these programs are. So your programs are very interesting, but they're not necessarily geared to the thousands of people that work in this kind of a field. But it's very important because if they're not healthy, they can obviously spread the virus, or they can be prevented from returning from work, etc. So has that ever crossed your mind? Have you thought about that? Do you want to have a conversation offline and think about it?
let me unmute myself. Yeah, absolutely. I think it's probably worth a conversation
Sure.
on it, because we do have, in this whole kind of time, we have we have return to care, return to work, back to school. So we have many different channels thinking
Sure.
about long-term care facilities, things like that, of how we might help help in unique situations like that. So absolutely,
Great.
yeah, I think it'd be worth it for us to have a conversation,
Great.
figure out what we might be able to do.
Sure.
Great.
Thanks.
Edie, I will make the connection for you and someone on the Quest team post the call today.
Terrific. Thank you, Jim.
Who else has got a question out there? All right, I have a couple if I can, please. Maybe you can talk and if you did mention it relative to the quick testing early on in the program. I guess the differences we hear so much about, you get a positive test, you have no, you're asymptomatic, someone's got to go for a test, the next test is negative, and now you still got to quarantine for 2 more weeks. So you get either a second negative so that at least there's a consistency of the tests. And so is the accuracy of the quicker tests that much less compared to the deep up into the sinus or the serology testing? Is there what's the difference between all of them, and how can we get them to be a little bit more mainstream reliable?
Yeah, so this is Ruth. I can take a first stab at that. Unfortunately, we don't have our medical colleagues on the line, but if you look at it from a sensitivity perspective, the current antigen tests that are on the market, not by Quest but by other providers, have a sensitivity that ranges between 80 to 84%. And because the sensitivity is so low, the FDA requires that if you test negative on such an antigen test, that you have to follow it up with a regular PCR test. So the likelihood that you test negative is pretty high. So if you have to do a PCR test anyway, then the argument is that it may not really help. However, from our perspective, we're trying to bring a rapid antigen to market that has a higher sensitivity. So we're working hard within our R&D lab to work on an assay that has a higher sensitivity that would not need to have that same requirement. But it also depends on how you plan to use this test, right? If this is a surveillance tool and you just want to continue to monitor your employees, or you want to use it, as Wendy mentioned before, when you board a cruise ship or when you go to, a Disney World or whatnot, and you use it as a surveillance tool to screen people out that may, walk in with a virus, you may not need that sensitivity that is 99%, and maybe for that purpose, 80% is okay. But if you want to diagnose if somebody in your office who is symptomatic has the virus and therefore needs to quarantine, you would want to have a more sensitive test. And I would always recommend the regular PCR test, the molecular test that we have, because they're simply more accurate. I just think there's a place for both in this pandemic. We see it now. The demand is high. There are many states where COVID-19 is growing and cases are growing. So the more testing that we can offer, the better. So I think there's a place for both, but the traditional molecular diagnostic tests are more accurate.
Terrific. Thank you.
Mm-hmm.
Who else out there has a question? Can't possibly only be me with questions.
So this is Ashwini. I would like to add that in the slides that we presented, in the very last slide, for anyone who's interested in any one of our programs, there is a link there that you can go to provide your information, and then you'll be contacted by a Quest Diagnostics representative to help identify and tailor a program that meets your needs.
Ashwini, I had someone ask, would it be possible to share your slides with everyone that attended the call today? Would that be okay?
Yeah.
Yep.
Yeah, we had those approved, so they should be
Yep.
fine. So,
Okay, great.
they're fine.
So for those on the call, I know a couple people already asked me for that information. They love it. So that's great. Thank you. I'll be sharing that with everyone. Thank you.
So if I can, maybe not so much a testing question, but since you guys are on the front lines of understanding the spread and the testing of that, maybe you can shed some other light on, you know, the whole concept of how the virus is spread and you know, the wearing of the masks, getting it so wearing of masks, face masks, and you know, getting this to be a non-political discussion and a true science discussion about you know, the truthfulness of how important it is for both, you know, all of the elements, right? The hygiene, the hand sanitizing, the wearing of masks, and the way it's spread. You know, there's such a, right now I'm serving on the restart and recovery, one of the governor's restart and recovery committees for businesses, and you know, we're all struggling with the idea that inside businesses have not been able to open and outside has, and there's a direct correlation between the spread, you know, from inside and close gatherings and so forth. So, so if you don't mind just sharing your thoughts and, you know, about not only CDC guidelines, but what you've come to understand about how the virus is spread and how important it is for the wearing of masks, et cetera.
Yeah, so I mean, you know, like you're saying, the opinions on this differ, right? In the beginning, when COVID-19 just started, there was a lot of thought about, okay, it's through, you know, sneezing or coughing, but the droplets don't stay in the air that long, and it doesn't survive on surface. Then it changed to, well, if you're going into a supermarket or elsewhere, you know, don't touch anything, wear gloves, because the virus can live on the surface for a certain period of time. And therefore, you know, if you get a package delivered to Amazon, just, you know, leave it out there for a while, and then when you bring it in, wipe it off. So there were all kinds of thoughts in terms of how the virus spreads. To be honest, I don't think it's entirely clear, other than that it spreads through, you know, respiratory droplets. It's not just through sneezing or coughing. We now believe that even through regular talking, you know, the virus can be spread. So that's why it's important to wear masks and you know, not so much to protect you from getting the virus, but it's from, you know, not spreading the virus yourself should you have it. So masks absolutely is a must. I have to say, took me a long time to score a great number of boxes of gloves, and now I see a lot of people not wearing gloves anymore. You know, I still advise people to use it out of an abundance of caution, especially the vulnerable population, because there's a lot of things that we don't know yet about this virus. So from my perspective, if you do go out, especially in the states where the prevalence is high, the more protection, the better. Washing hands is always a good thing, even prior to the pandemic. Now even more so. You know, wash your hands regularly. If that is not available, then use hand sanitizer, and don't touch your face and your nose, which up until the pandemic, I never realized how tough that is, not to touch your face throughout the day. So,
Ruth, I think everybody on the call was nodding their head yes about that comment about how hard it is to not touch your face and your nose and scratch your eye and do all of that. Listen, I appreciate your honesty on that. You know, I think it's so important. I think the reality is we're going to be wearing masks, and there'll be plexiglass shields and in front of for a considerable amount of time until we truly understand the nuances of this virus in ways that we don't understand it now. And you know, we as a business organization, and the same thing with Chip Halleck at his organization, you know, we try to lead by example and try to provide our our business members with good, accurate information. And so as an ongoing effort, quite frankly, I wouldn't mind, and I know Chip, I could probably speak for Chip, and that please continue to share the things that you learn. We as a business organization tend to be just conduit information to our members, and sometimes they members have the ability to jump on a call like this, and sometimes they still need that information, but they couldn't jump on the call, and we need to be able to get that information to them in other ways, and we will, and we do. But as an ongoing effort, please help us to disseminate that information. And as you learn things about testing and whatever, share it with us so we can share it with all of our members, small, medium, and large businesses alike, and continue that flow of information.
Absolutely. More than happy to.
Thank you. Chip, any parting words from you, buddy?
No, I want to agree with you there, Jim, at the end, and we'll certainly share the contact information for Quest that was on that latter slide. I had some questions, but I have to tell you, it was a very complete presentation, including the small business solution, because I'll have to be frank, I wasn't aware of that, and I think that's a great plus. So many of our businesses don't think they have the resources to do right by their employees, and you're pointing out that there are different arrangements that can be made. So I think that was a very valuable part of the presentation today, and appreciate it.
Yeah, I agree with that, Chip. And Wendy, and I know you or someone will have a conversation with Edie about her industry, but also maybe we should think about how organizations like Newark Regional Business Partnership and the Meadowlands Chamber can be umbrella type entities relative to the business members that are in our organization, and how can we provide those kinds of services as an umbrella to what Quest is providing to, especially to small and mid-sized companies, businesses, and streamline it, so that it's worth your while to be in that marketplace. And perhaps we can brainstorm about how we can effectively help them, because that's our job.
Absolutely. It makes complete sense. Yep, certainly.
Great. Well, so I'll pause for a second. If there's any parting question, I want to say thank you to our panel. I did scratch off a whole bunch of questions along the way, as Chip did. Despite the fact that I threw a couple of questions in there. So yes, the presentation was very, very complete, and I was pleased to see how you identified the small and medium-sized business market. So thank you to that. And to those that are on the call, if you have any follow-up questions after today, please reach out to either Chip, if you're in NRBP, or me or Alex or anyone on the Meadowlands Chamber team. We will make sure that we can get that information to our friends at Quest and continue this dialogue well into the future. So thank you, everyone, for being with us. Alex, thank you
Thanks so much. This is great.
Ladies, terrific information, and thanks to Quest for being a great partner to our organizations.
Thank you.
Thank you for having us.
Bye, everyone.
Thank you.
Bye-bye.